This is Johnny Science with OhioCannabis.com. I'm here with Rob Ryan of the Ohio Patients Network. How are you, Rob?
I'm pretty good. This is an interesting day. We're talking about testing and the other aspects on the medical marijuana program here, control program.
This is the third or fourth advisory
I think this
meeting.
is the fourth.
Yeah. Today they were going over also how much you're allowed to have. They're talking about 90-day doses.
The 90 days dosage. Now, this is where I think they're fooling themselves a bit because they're talking about 1/10 of
A gram
yeah.
per day.
Well, 1/10 of an ounce.
Oh, that's what it was.
Per day for 90 days, and so that's 9 ounces for the 90 days. And to me, and looking at what the federal government sends its patients is 200 grams per month.
It's a big difference.
That's a huge difference. You don't need to change that conversion between grams and ounces, to see that that's a huge difference.
Well, and Nancy, the nurse that's on the panel, she actually brought it up that there's other states, about 15 other states, that have a higher allotment of your available medicine, and the Ohio's board wasn't taking that into consideration. They kind of went with the lower end of the spectrum.
They excluded a lot of states in coming up with these amounts, and some of them are just, you have access to say a dozen plants and so many ounces at any given time, and not within a time period. A lot of this varies tremendously on a person.
Right.
There's some that are, just need a little bit, not very much, and there's some that, will take a fairly extensive amount.
And different forms of administration. One thing that Nancy also pointed out, the board said that for any children under 18, they're not going to be allowed to vaporize. Well, how are you supposed to get instant access to that medicine, instant relief, without smoking or vaporizing it?
Well, that's one of the big things that people don't seem to understand is inhalation is actually a very effective method in that one of the things it brings out is because it acts so quickly. Right. Okay.
And as Dr. Wink said, it goes directly to the brain. It doesn't get metabolized through your liver, so it is an instant and almost 100% access.
Yeah, and the other thing that comes in, I think, is very important is the fact of self-titration. Okay, I've had enough. This is enough
you can cut
that
yourself off.
I was like, okay, I don't need to anymore. Yep. Okay, and I can go about my business. Sometimes you only, for instance, on some patients, it's just a couple puffs, every couple hours, and if you have to take a certain amount, it's too much, too little.
And some kids can't swallow pills. They can't do edibles. They need the inhalation.
Yeah, quite frankly, I'll be not politically correct here. I think they've overblown the no smoking. Yeah. The largest lung study they ever conducted, I think, was Dr. Tashkin. Essentially came up and said, smoking marijuana versus cigarettes is like not dramatically different.
And even if vaporizing is obviously considerably better.
Yeah,
but,
right.
We only have about another minute or so because they are starting back up, I think. I know one other point that you wanted to go over as well was you'd like to get...
I have been working on gathering material, talking to various folks, doctors and addiction specialists, and the Ohio Patient Network is going to work very hard to get addiction as a qualifying condition. I think that's very important because it works. Marijuana is a gateway drug, by the way. It's a gateway off of the hard drugs.
Alan and I have been saying that for a while now. It's true.
It's true. And I have the data to back it up.
Yeah. And the people that are on it want something better. They really want a different solution. And other states have already stated, the Journal of American Medical Association said that a 25% reduction in
But that study's been
deaths.
replicated. They did the Medicare Part D, where they showed this dramatic reduction in the number of pain pills that are done. You know, it's just, it's there. It's real.
And Ohio needs it. We are the worst state in the whole country for a heroin epidemic, and we need it more than anyone.
Yeah, it's quite interesting. I was down in the epicenter of where Ohio originated all this opiate overdoses, down in Portsmouth, Ohio. And I was pleasantly surprised at how supportive that community was. And I was, in a panel of the police chief, the health director, the judge, the drug court guy, the Drug-Free Ohio, in this universities, American Women's Universities kind of setting. And it was very, very supportive of adding that condition as a qualifying condition. So thank you very much.
Thank you, and Rob, anything we can help do to push your cause and the opioid crisis, please let us know, and we'll work with you some more in the future.
A little plug is Ohio Patient Network is a 501c3, and
Rob's done a lot of great work as an activist for a lot of people. He's very passionate and really believes in medical marijuana.
And I try to put out the best knowledge and materials possible.
You've been some of the best information out there. So once again, this is Johnny Science with OhioCannabis.com, and we thank you, Rob, with the Ohio Patients Network.
Thank you.
Take care.
Take care.
Bye-bye.
Sweet dreams are made